And now, Dr. Krieger's lecture program starts right now.
We're ready to get started. I'll have to follow along with you, just like I'm sitting in the audience. I'm having problems with my computer. I lost my PowerPoint slide presentation about 4 hours ago, so I've been kind of fumbling around, and I finally got it back. So, I'm Dr. Krygier, people that don't know me. Tonight we're going to be talking about fatigue. I mean, fatigue is huge in America. Fatigue is partly from foods. Fatigue is partly all different sorts of things. So I'm going to go through and kind of, when I think about this subject, it kind of gives you guys an idea when you refer people to me or when you come in yourselves, what's going on in my mind and what I'm thinking about and how I'm relating the science and the research to your problems. I mean, basically that's what I want to portray up here. There'll be probably some terms that you won't understand, but the basic concept is up there of different reasons of why people get fatigued. We all get fatigued at one time or another, but the issue is, do you stay fatigued? Do you get sick and then get fatigued? Do you get sick for long periods of time and then for 2-3 months, now you're fine? So there's different levels to fatigue that we all know. Most of us haven't experienced, the very chronic fatigue, but we're all in and out of fatigue at one time or another. And some of us are still in fatigue and we can't get out of it, and that's what I want to talk about tonight. So this is a daily supplement protocol. I believe it says on my webpage, top of my webpage, it says 90% of all disease is caused by nutrition. 90%. And I want to rephrase that word nutrition because, that's assuming that you can eat right, and it's very difficult to eat right these days. But I'd like to rephrase that and say it's 90% of deficiencies of natural compounds instead of nutrition, because people think nutrition, diet. I just got to go on a diet, I'll be fine. That's not the way it works. In my practice, I'm very specific. Yes, I'm a nutritionist, but I relate nutrition with how it affects our bodies and our physiology, which causes disease. So that's what I want to talk about tonight. I believe that fatigue indirectly has its own issues, but overall, your body can recover if you have the right doctor to tell you what to do, and that's me. Here's my webpage. It's drkrieger.com. I sent out a newsletter. I think probably my worst, I had a lot of asthma and allergies growing up, so my worst pet peeve was sitting in a doctor's office for an hour and a half, and you got the paperwork filled out in 5 minutes, but you're not seen until an hour and a half later. So this way you could do the paperwork and it could speed up your process, and you don't feel like you're running around, or if you have kids, you're not, you don't have to watch your kids and fill out the paper at the same time. So it's just it's a better convenience for most people. So that's all the information. I have a web service going on with this web page, a member service pretty soon. I got tons of information. I'm just trying to get people healthy, trying to get people better, and try to educate them on how they can do that. I want to read this real quick. This was a funny joke I read. Okay, this is by Surfnut. A man who smelled like a distillery flopped onto a subway seat next to a priest. The man's tie was stained. His face was plastered with red lipstick. Half-empty bottle of gin was sticking out of his torn coat pocket. He opened his newspaper and began reading. After a few minutes, the disabled guy turned to the priest and asked, "Say, Father, what's the cause of arthritis?" "Mister, it's caused by loose living, being with cheap, wicked women, too much alcohol, and a contempt for your fellow man." "Well, I'll be," the drunk muttered, returning to his paper. The priest, thinking about what he had said, nudged the man and apologized. I'm very sorry, I didn't mean to come on so strong. How long did you have arthritis? I don't have it, Father. I was just reading here that the Pope does. I thought that was kind of cute. And I could get away with it because we just changed popes. So. I had a patient that just sent this to me recently. It was kind of neat because a lot of people get a bad stigma about chiropractic, about taking care of their spine. They don't understand. There's a lot of misinformation out there. They're scared of their doctors, especially chiropractors. But this was interesting because it said, have you ever heard of a spine transplant? Neither have we. Take care of the one you have. There's not going to be spine transplants. Okay? I put this up there because often people take for granted until something happens. They're like, my neck bothered me. The thing's probably been out for a year, literally. The body does a good job of covering a crisis situation and hiding injuries until we think it was picking up the pencil or reaching up to grab something or whatever scenario there is. So I usually tell people, you should get their spines checked at least once a month. This is a 3-week purification program that I sent out to a lot of people. There's a lot of sick people out there. People don't know where to start. They don't know what to do with their health. They don't know, there's so many different situations, but this covers a lot of them. And I wanted to present this to people because obviously it's spring and we need to do things because a lot of our winter things carry over into spring and summer. A lot of winter people, that have allergies or they have infections, a lot of those carries over in the spring and the summer because our bodies, our liver needs to be cleaned out. We have cholesterol deposits, we have calcium in the liver, we have stones, we have all these kind of sediment issues, and this kind of takes care of it, and it's only 3 weeks. It's a 3-week sacrifice. It's probably one of the most extensive programs out there, and it's a book. You can follow it through, and it can change a lot of things, including the things listed here. So I thought I'd put that in there. Fat loss. Everybody brags about fat loss. And I put this up here because you watch the Dr. Oz show, and 1 week it's raspberry ketones, and the next week, it's some tea, and the next week after that, it's, I don't know, some cabbage or something. Who knows? But anyway. So what I did is, obviously when I go in front of people, I have to have the research, I have to have the science to back it up, okay? I just can't do a show on television and then screw it out the back. So this is a fat loss that I use. It's called 7-Ketozyme Forte. And one of the hardest ways to lose weight is through belly and hip fat. And on my webpage, that I can't put up here, but it's under drkrygier.com, if you go to order now, go to biotics, and go to this product, it will bring you to the research article talking about how this product or this chemical here can actually raise your resting metabolic rate. Now, most of us only work out for an hour, hour and a half. What do we do for 22 and a half, 23 hours? We're resting. So it would make sense to take advantage of something while you're at rest and just not something to pick you up while you're working out. Okay? So it's a flip-flop way of looking at it. Not that you don't have to eat right, eat right and sleep and all that stuff, but this gives you a huge edge because this actually is thermogenic and raises your resting metabolic rate. So if you're looking for something that's got a great track record, it's got the research behind it, and I believe a lot of people will be happy and it'll be a success. Now, the first thing you want to do on fatigue, because most people, I don't know if I'm tired, exhaustion, so I wanted to define fatigue. And it says basically your overwhelmed, sustained feeling of exhaustion or a diminished capacity for physical or mental work. Usually, the physical leads to the mental. But In different scenarios, under the definition, the condition of an organ or tissue in which its response to stimulation is reduced or lost as a result of overactivity. To cause fatigue, fatigue may be the result of excessive activity which causes accumulation of metabolic waste such as lactic acid, malnutrition, due to a lack of carbs, proteins, whatever, circulation disturbances such as heart, respiratory, metabolism, endocrine, emotional, all these different things can create issues with fatigue. I want to talk about the one that's not listed in here, that most people don't realize, that a lot of it goes undetected. Now, I am not a synthetic hormone doctor. Okay? There may be advantages in very acute situations, but a lot of us, look at what happened with estrogen, synthetic estrogen. That's a hormone. You can just throw synthetic estrogen in, help all the postmenopausal females with all their problems, and voila, somehow, it's just going to go away. Well, it's not. It's causing breast cancer, it's causing uterine cancer, it's causing all different sorts of problems that always come out 7 to 10 years later. There's a cycle of research that comes out, and it should have been studied before it came out. So I put low testosterone, get it tested. A lot of people think they have it. You can be a bodybuilder and have low testosterone levels, where you're actually compensating and overstimulating the body so that, you can get through the day or your motivation or your sex drive or whatever it may be. But, there's a difference between thinking and knowing. And the only way to or to know is to be tested and find out if you fall in that category. Women could be just as much deficient in testosterone as men, even though they might not have as much, but testosterone is very important in remodeling bones. It's important in motivation. It's important in sex drive. So I put these two things up here because you see this stuff all over television, and somehow you're just going to go on a drug and think you're going to get better. The best way, I believe, to get your testosterone up is this product here that has great research, and you don't have to, it's not synthetic. It's all natural. Let's go back to fatigue. Fatigue is referred to as tiredness, exhaustion, lethargy, listlessness. Has anybody been diagnosed with chronic fatigue in here before? Chronic fatigue syndrome? No? Okay. But chronic fatigue syndrome is basically a diagnosis of, you have to have we'll look at the symptoms, but you have to have it for longer than really 6 months. It's a long time. And by then, now your body's being depleted on not only an immune system, but your endocrine system's weak with your hormones, your nutritional status is weak because you've been trying to fight something off. So there's a lot of compounding things that can create it and not realize that, oh yeah, I've had it for a year, and then you come in to the office and you're not better in a week or two. So patience is very important when you're dealing with fatigue, because usually it didn't take that, it doesn't take that long to see results, but people have had it far longer. When someone experiences physical fatigue, it means they cannot continue functioning at their normal levels of physical ability. Mental fatigue is more slanted towards feeling sleepy and being unable to concentrate properly. Fatigue is a symptom rather than a sign. So there's Gulf War syndrome, there's fibromyalgia that comes with fatigue, there's chronic fatigue syndrome, there's cancer. There's all sorts of things that can create fatigue or the symptom of fatigue. I want to get behind the issues of the symptom that I can control and what I control in my office. A symptom is something that a patient feels and describes, such as headache or dizziness, while a sign is something the doctor can detect without talking to the patient, such as a rash. Well, I'll tell you right now, with fatigue, what do you know, when you look at somebody that's really fatigued, when you look at their face, what's the first symptom that somebody has fatigue? Even though they might not admit it, they have the bags under their eyes. They have their lymphatic, they call these allergic shiners. So the lymph system has to actually come around, and the lymph system is where, it's like the war zone where your immune system fights, say, a battle. So there's different reasons that the lymph system can be backed up, but most of the time it was created in the 60s, and they call it allergic shiners for kids that have allergies. So under the eyes is a good way that you get to detect, is a great sign that your body is going through fatigue. You don't have to really ask the patient or anything. You'll walk out here, go to the mall, and you'll start looking around, and you're like, my God, if there wasn't makeup, if there wasn't hemorrhoid cream. And I tell people that, you know what they use hemorrhoid cream for, right? Those are the supermodels. When they get the bags on their eyes, put hemorrhoid cream under there, so it tightens and puckers everything up. So you look nice. So I don't recommend it because somebody can get it in their eye, but it works good. And the product I use for a lot of lymphatic is called horse chestnut. It's the second most prescribed medication in Germany for a condition called thrombophlebitis, inflammation of the venous system, to tighten, pucker the venous system, to push blood out of the legs or the arms and put it back into the circulation. Here's some fatigue statistics that I was pretty surprised by. National Institute of Health, 1 in every 5 Americans claim to have fatigue that is severe enough to interfere with daily normal life. Fatigue can also affect healthy individuals after intense mental or physical activity. I would think of somebody passing away, a mourning, a grief in the family, severe depression. It's usually due to a situation, and you can kind of link it back. I thought this was interesting. I didn't even know this, but around 20% of the fatal road accidents involve driver fatigue. According to VIX Roads Accident Facts, 1998, about 30% of severe single vehicle crashes in rural areas involve driver being fatigued. So we don't really think of, oh, it's not me that's the problem, but there's a lot of people out there that are fatigued. 80% of American women will suffer from adrenal fatigue. That one's huge because adrenal fatigue, your adrenals actually are the ones that create all the hormones that cause your body to get energy and to run your energy pathways. Adrenals are really important. A lot of females, I think this number is high because a lot of females go through perimenopause, premenopause, and then postmenopause. So a lot of those issues, if your adrenals aren't healthy and you're going through those situations, then you'll have a lot of fatigue. Grumpy, cranky, all that stuff. That's all adrenal fatigue. 50% of adults who seek medical treatment complain of feeling fatigued all the time. This was kind of interesting. Fatigue is equal to blowing a .05 after 17 hours of an alcohol concentration. And after 21 hours, it's .15. So you're drunk with fatigue. What are the signs and symptoms of fatigue? Obviously, severe exhaustion after physical or mental. You do not feel refreshed. You feel like, God, I just slept and I got to go back to sleep. Your body's not resetting itself. Patients describe fatigue, especially chronic fatigue, as overwhelming tiredness. This is an important one here. Some people find symptoms get worse after exercise. Okay, usually when you have fatigue or when you're feeling a little bit tired, when you go to work out, you actually pitch your energy up. You feel better. You never thought it would. But most people that have chronic fatigue, they just won't. They'll exercise and they'll wipe out the next day or two after the exercise. they get what's created like a lactic acidosis, where their body can't clear lactic acid from the body, and it spills over, and they can't get rid of it because their energy metabolism is so slow, and they need something to kind of pick that up a little bit. Thiamine does a great job with that, which is Cataplex B. Fatigue signs and symptoms may be physical, mental, emotional. Here's some of the signs and symptoms of fatigue. Bloating, abdominal pain, constipation, diarrhea, irritable bowel, basically. Aching or sore muscles. Okay? I can tell when I'm coming down with the flu right away. The first sign coming down with the flu is I feel it through here. I'm like, I didn't lift, I didn't run, I didn't do anything, I didn't move, but my back muscles and your glutes, they start to get tired. Which is kind of interesting. That virus, a lot of the viruses that go after the body go after this area. They resonate at this area through here. And they can cause what's called Guillain-Barré syndrome. Anybody heard about Guillain-Barré? Side effect from the flu shot. So apathy, no motivation, difficulty in concentration, hallucinations, hand-eye coordination, headache, judgment, indecisiveness, irritability, loss of appetite, moodiness, poor immune system, short-term memory is impaired, sleep response to stimuli, slow responses to stimuli, and then slower than normal reflexes and some vision problems. These are the causes, the main causes of fatigue. Infectious disease is probably one of the main causes of fatigue and you don't even know. And I'll explain that further. Infectious disease, and I put that at the top, not an acute infection that you have, but after, it's called post-viral fatigue. After you've been sick and you're like, God, I don't have any symptoms, but I'm tired. That's post-viral fatigue. Post-viral fatigue can go on for a long time and is very dependent on lifestyle factors. How much sleep you get, do you come home from work, and work through the night? Are you on a nutritional program, or are you eating beer and donuts and chips and stuff like that is going to affect your body because of nutrition. Medications are huge. Medications, I'm going to list all the medications that cause fatigue. Heart and lung problems can cause fatigue, obviously. I'm going to give you an example of that, and then lifestyle. Chemicals, I got a good example of that, and then obviously nutritional deficiencies. Infectious disease, they did a study and they found is one of the principal contributors to fatigue. Now, you got to remember in medicine, there are no truths. There's no absolutes in medicine. They're just like, well, it's probably this. So there's a lot what we don't know, but when I looked through the research and kind of added things up, infection was probably one of the main contributors when they did the research. It was always in the category of 75 to 80% of cases were associated with the onset of an infection. Okay? So you should probably just go get your antibiotic and we're done with the lecture. Right? Well, antibiotics don't do anything for viruses. That's how you can be tired, been on an antibiotic, still feel sluggish, not feel right, and you're going on your second or third antibiotic. Even children can be affected. Now, this is interesting because I started looking at this, I'm like, wow, this is interesting. These 8 viruses do something pretty neat in our body. These are all your herpes type viruses that infect humans. Okay? They're passed. I use the example, you could be a cloistered nun and have one of these, meaning no sexual interaction, cloistered, and have one of these infections and not know it, but feel the remnants of it. So this one here, herpes simplex 1, sexual Herpes simplex 2, here's your shingles. Type 3, everybody has that at a low level. Here's Epstein-Barr virus. I had a patient, everybody, I don't know about you, but when I look through the information on the research, it says that chronic fatigue used to be called chronic Epstein-Barr virus syndrome. They changed it. But Epstein-Barr virus is probably one of the main causes of all the symptoms you'll see in a little bit of fatigue in general or exhaustion. Cytomegalovirus type number 5. Herpes virus number 6, which is mostly what kids get. You know, their ears turn red, their cheeks are red. But that can cause seizures, that can cause blood sugar problems, all kinds of problems. So a lot of what our bodies are doing, it's in a state because this is leading and our bodies are proceeding instead of our bodies leading and suppressing these things. Herpes virus number 8, Kaposi sarcoma, that's usually related to the AIDS, or acquired immune deficiency. If you understand the immune system, which is very simple, the immune system has cells that release certain chemicals that tell the body what to do, okay? These cells here, right here, are all your viral side. This is your immune system here that goes after viruses, okay? These viruses actually hijack and cause this to work harder in your body so that the virus doesn't go away. See, these are T helper 1 cells. This is your main way of fighting viruses. The helper T2 cells, these are the way of fighting bacteria, allergens, toxins. Those are the way, this is what we're mostly dealing with. People, I found, are on more Allegra, they're on more allergy medication because this side of their immune system is ramping, or this side of their immune system is shut off and it's ramping up this side of their immune system. And they think they got it, they probably do have allergies, but it's the virus or the viral that's causing this side to over-secrete all these different chemicals, and I put them up here. This is the main one. This one right here, this number 10 here, viruses actually cause this chemical to be overproduced and keep on cycling and causing this to happen more and more and more. That's what the research shows. Basically, your liver function, all these chemicals, are produced in different cells in the body, but the liver is responsible for regulating these chemicals or resetting the one side as opposed to the other side. So as my job is to find out, as a doctor, which is the safest, healthiest, most efficient way to flip your immune system. These are all the chemicals that make you tired. Those are all your fatigue chemicals. Interleukin 10's one. I just put an example up here, but this one right here is interesting because I'm going to give you an example of this one. Interferon, when they wanted to treat like AIDS patients, remember that AZT back in the day, those chemicals they used, and they actually killed the virus, but they killed you too? Well, they did a study on hepatitis. And what they wanted to do, they knew that this interferon is very important for engaging the viral side of your immune system. So what they did was they gave them interferon for hepatitis. There's different hepatitises, but I think the one they were testing for was hepatitis C. When they gave that to the hepatitis C people in the study, they realized a bunch of them committed suicide. I'm like, wow, this is, what the heck's going on here? when you raise interferon levels, you lower serotonin. So when interferon goes up, serotonin goes down, and serotonin's your happy hormone. So then the body switches back, it switches back to this side, and it doesn't allow it to continue on this side. That's your depression, that's your mental illness, there's your neurotransmitters. That's how certain infections, a lot of the infections they're finding now are related to these chemicals, because these chemicals cross the blood-brain barrier and affect how quickly certain neurotransmitters, for example, serotonin, gets broken down. And if it's too fast, you don't feel good. You're like severely depressed. So a lot of people are in and out of this vicious cycle, and they think that's why Prozac got rushed to the market so quickly. It only took 6 weeks. A drug usually takes a long time to go through its procedure to pass, and $600 million and a bunch of politics. But interferon, that was why, because of the effect of that. And it lowered serotonin. Now, this is what I do, because you're not doing anything for the virus. You're trying to get the body, you're trying to wash those chemicals out of the liver. The liver is involved in making pain chemicals, and those 4 chemicals over there are called cytokine chemicals. When these chemicals are too high, you feel horrible, you're weak, you're tired, you feel like, God, I forgot what I was supposed to do today. I mean, there's all kinds of symptoms that would relate to fatigue. So, these 2 things, one is a mechanical, I use Liviplex to actually mechanically get the liver biliary system going, because in Epstein-Barr virus, 50% of the virus is actually washed out through the liver biliary system. So if you enhance the liver biliary system, the liver and the gallbladder, you'll get it out of your system quicker and faster, and then your body won't keep on creating antibodies and overreacting the immune system all the time. That's the big discussion I have with patients, is they're like, oh, I don't have Epstein-Barr, I don't have mono, or I don't have this, or I don't have that. My doctor said if I had it as a kid, I don't get it again. Well, I had a patient that he got Epstein-Barr virus 4 times. How do you get Epstein-Barr virus 4 times if your medical doctor says you can't, once you're exposed to it, you can't get it again? This is a low-grade infection that wears you down and makes you tired. The way it happens is there's a system in the body where the liver doesn't produce enough bile, and it's called Gilbert's syndrome. And with the chemicals and the foods we eat, it's very difficult for us to create the right amount of bile and to remove infections out of the body. That's why gallbladder issues are such a problem in America. If you don't have the liver and gallbladder working together, you can't bind the virus and carry it out of the body. That's one of the ways that the body protects itself. So using Liviplex, and this is more my immune, where it blocks the 4 chemicals so that you don't feel tired. Because once you get those chemicals out, you don't feel tired. Okay? You gotta get your body above your immune system. And that's where alternative comes in, because they can't give you interferon, they can't give you all these other, they don't treat viruses. This is why, they'll kill you. But there's ways in alternative medicine to focus, wash the chemicals out, get the liver biliary system, make the adrenals stronger, make sure the thyroid's not bothering you, make sure you don't have allergens. I mean, you can go through all these scenarios. Mental health, those cytokines, they believe there's certain cytokines that actually make you depressed, like I said. If you come here, here's chronic fatigue syndrome. They did a study at Emory University, and they tested the interferon that I told you, which causes chronic fatigue symptoms like fatigue. This is what I told you. They were produced by the white blood cells, and they help the body fight infection, especially viral infections. The one cytokine, which is interferon, there's alpha, gamma, beta, all those, but just interferon, protected the body against viruses. Because it interferes with the ability of viruses to spread, lets the body get on top of it. What they found at Emory University is this interferon actually affects interleukin 6, and that interleukin 6 was on those 4 charts listed. That interleukin 6, that makes you tired. When you're an athlete and you're working out and you start to feel tired and the weights are getting heavy or your legs are getting heavy, that's interleukin 6 being released in your body because of fatigue. And I'll show you a pretty cool article. But what happens is when that gets high, interleukin 6, serotonin gets low. And when serotonin gets low, interleukin may decrease serotonin in the brain, leading to depression. Because your depression might be from a viral, and your immune system overreacting to that chemical that's produced by the liver, and you can get rid of it. This was kind of cool. I like this because I was an athlete. But fatigue is in the mind, not the muscle, suggests a new study. They found that, let's go down here, our colleagues at the University of Cape Town in South Africa demonstrated that ubiquitous body signaling molecule called interleukin 6 plays a key role in telling the brain when to slow us down. Blood levels of interleukin 6 are 60 to 100 times higher than normal following prolonged exercise, and injecting healthy people with interleukin 6 makes them feel tired. Okay? To work out if interleukin 6 affects performance, Robinson injected 7 club standard runners with either IL-6 or a placebo, which is nothing, and recorded their times over 10 kilometers. A week later, the experiment was reversed. On average, they ran nearly a minute faster after receiving the placebo, a significant difference since their finishing times were around 41 minutes. The findings will appear in the Canadian Journal of Applied Physiology. So basically, what I tell athletes, you don't have to do steroids. You don't have to do all kinds of steroids or illegal drugs. All you have to do is lower that chemical, and you make yourself more efficient and you're less tired. So you get more done. And with an athlete, that's a step, that's a stride, that's the speed of something a little bit faster than you've had. Just by doing that. And there's something that I use in the office that I give to people that work out that blocks that chemical. So you get more reps, you get more sets. So there's the research to back that up. There's brain behavior and immune, chronic fatigue syndrome, the immune system, and viral infection. Basically, they couldn't figure it out. They couldn't find a virus. They knew that these cytokines were monkeyed up a little bit, but then they come down here and they said the ability of the certain herpes virus to impair development of T-cell memory may explain this viral persistence and the continuation of symptoms. So they give you a hint. Nothing's really showing up in our testing, but this is the issue at hand. Toxic causes of mental illness are overlooked. Because in the University of Alberta, everybody knows they don't do anything for heavy metals, pesticides, plasticides. The only one that really does anything for this stuff is Dr. House on television. Does anybody watch the House on television? What does Dr. House do when somebody has something they can't figure out? He sends them out to your house to look around. Look in the kitchen. Look at the chemicals close to the foods. So the point is, there's a lot of poisons that activate this side of your immune system that cause those chemicals to be high. That doesn't allow things to reset. And then you get exposed to a virus, and now you're stuck in this vicious cycle. So basically, all these chemicals have not been fully appreciated by the medical community and has been yet to be incorporated into clinical practice. Here's a hair analysis that I run out of the office. This is a way to look at your toxicity level, especially with toxic elements. It's a forensic test. It works when you're dead, but somehow it doesn't work when you're living. That's a joke, because you want to know when you're living. So when things get a little bit higher, it shows up in your sulfur bonds up in your hair. So if that's higher, you know there's been exposure there. And a lot of this stuff has a tough time leaving the body. So if it's showing up high in the hair, unless you've been at, unless you work at a factory or something. So they had a cool, on the Learning Channel, there was a wife that was poisoning her husband. It was actually a poisoning case with thallium, and thallium causes you to die very slowly. He's got his hands over his wife's ears. But I was just flipping through the channels and I started hearing this. It was kind of neat. But every morning, his wife would put a little bit of thallium in his lemonade that she made him every day. So they couldn't figure out. He's been to all these doctors. They couldn't figure anything out. So the only reason that caught my interest was finally they did a hair analysis in the hospital. They're like, oh my gosh, her thallium was over here. His thallium was over here. Then they figured out every time she went away, it got better. So I was surprised. I was intrigued by that because they used a hair analysis in the hospital and they don't usually do that. It was a last resort. If they just would have ran it. Gold? I'll tell you, you can poison yourself with water if you drink too much of it. There's a fine balance in this stuff. Here's some of the primary supplement supports. Not to overdo this, but these are ways you can push these things out of your body. I don't want to harp on that too much. I just want to let you know there's an option if this is an issue. Here's when we talked about the interferon alpha, this is what I use on a lot of people, because a lot of people, as you go after a virus, if you go after, to get their immune system, support their immune system, this virus can get a little antsy. It's kind of like, using stuff to kill mold and mildew and yeast and fungal and candida in the body. You get a die-off and it can make you feel worse. So this is one of the pills I use when people feel worse and you're trying to get that immune system so your body can push that virus out of your body. Hormone metabolic is a big cause because a lot of women that I'm finding, due to viral and these different poisons and all that, they're testing for a lot of antibodies to their endocrine system, like their thyroids, like Hashimoto's and Graves' disease and all that stuff. So we're testing for a lot of thyroid. Even the adrenal glands, they're a little bit more resilient than a thyroid, but they are testing for adrenal fatigue. Liver, liver is responsible for about 500 things. And I tell people, if there's a poster in my first room in the office, you walk in, there's a poster, and the liver's up here, the 3-week detoxification purification program, that green slide you saw back there, and then everything comes down from the liver. Because adrenal glands, thyroid hormone, synthroid, thyroid stimulating hormone, all these are converted in the liver. They be made in the glands and released in the blood, but they're actually, the work is done in the liver processing it. So you could have a great thyroid, bad antibodies, but your liver has trouble processing it, and that's what's causing the antibodies to go up. And they don't run the panel, and they don't tell you anything, and you're fine, and the only thing really left to do is just get your thyroid taken out or go on Synthroid for the rest of your life. You don't feel good. That's why. adrenal glands, you got a cortex, you got a medulla. The medulla is basically all your estrogen, testosterone, pregnenolone. Your cortex is actually where cortisol is produced. So a lot of times with your immune system not working and not regulating right, you can't produce enough cortisol, or you overproduce cortisol, and you have trouble in the morning because your cortisol is supposed to rise and fall throughout the day at a certain level. And if it doesn't, it can easily make you feel like you're... I tell people that are adrenal patients that need support with adrenal, they hate the morning. They hate waking up in the morning because they're just exhausted. But once they get going, man, they don't want to go back to sleep. They want to just party all night. They feel great. So your adrenal people are the people that have trouble in the morning, and then the people that are perky and happy and do pretty well, those are usually people that have healthy thyroids in the morning. And they could have weak adrenals with the thyroid's compensating. Keep on going here. Here's some adrenal fatigue, some symptoms. Low blood pressure, sensitivity to light, digestive. It was like the whole last two lists that we saw. And does everybody know that adrenals sit on top of the kidneys?
I do now.
And they regulate the fluid in the body. And they produce all the hormones. And this test right here is one of your better tests, along with the Acera and just looking at the symptoms. This is a sitting and standing blood pressure. Where you can lay down and stand up. But this is called Ragland's test. And with people that have really adrenal fatigue, when you're sitting down, you're relaxed. And you go from a sitting to a standing position, those adrenals release more epinephrine. They constrict the arteries to put blood up into your head. So if you're not getting blood up into your head, how are you going to feel? Your heart, you might be like, God, my heart goes fast. And I got an arrhythmia or something, just because your adrenals are weak. Or I got a headache because I can't get enough blood up into my head and I feel like I want to pass out, or I feel tired, or I feel dizzy, or I get vertigo. All that stuff is just from a simple, you can tell from this simple test, because your blood pressure is not compensating, pushing up against gravity. Adrenal restoration is easy. These are my two favorite combinations. ADP5, it's named that because it stands for adrenal, and the B5 stands for pantothenic acid. That's a good one. That's a nice stimulant for the adrenals. And then withania, this is more of a crude drug. I mean, herbs are crude drugs. So I use this one if you have both a weak cortex and a weak medulla. Both of them are very weak. Somebody could have Addison's disease and have a weak cortex, and all their other hormones are perfectly fine because it's a different part of the adrenal gland. So these two are for more hormone restoration and people that have really chronic fatigue. Here's medications that cause fatigue: antihypertensives, antidepressants, tranquilizers, sleeping pills. That's why they put you on, when you have fatigue, that's why they put you on fatigue medication. Because you're tired, they put you on a sleeping pill. You can't stay asleep, so it kind of messes you up. Antihistamines are huge. People that have allergies, intolerances. Antibiotics make you tired, diuretics, illicit drugs, alcohol. Look at these, some of the prescription and nutrient deficiencies. Diuretics, potassium, magnesium, I mean, that's probably like 80% of anybody over 70 years of age. If you're over 65, 70 years of age and you're not on a potassium and magnesium, it's like you missed the boat. And you're on some type of diuretic, you have to be on those minerals because those diuretics will wash your minerals out. Dilantin, it's a folic acid. Aspirin, good golly, how many people are on aspirin? I mean, that's the drug of choice. You can't get away from it. Aspirin causes folic acid and iron. Iron's huge for causing fatigue, and if you're deficient in iron, you ain't going very far. It's that simple. You'll give out in the second half of the game, the third period, the last third of usually iron really kicks in. You just wipe down.
Does the salad music do the same thing?
No, because it's got all its together.
Okay.
Salagesic doesn't do that, but if you stay on it long enough, it could. But you don't want to be on, that long. You want to use it, learn how to use it. And then a high blood pressure medication, big one's vitamin B6. That one's huge. And a lot of high blood pressure medications can create neuropathies, and big neuropathies, which is numbness and tingling in the nerves, peripheral nerves, nerves in the feet, hands, all can be related to B6, B12, folic acid, all those issues. So, I mentioned the viral thing, but when you're dealing with a high blood pressure, you gotta watch these things because they can lead into other issues. Tagamet, if you're not getting enough protein, you're gonna be tired. Proteins make amino acids, hormones, enzymes, everything. So if you're not digesting and you got a GERD problem, you got a B12, you got a protein deficiency, you're just not going to survive, or you're not going to be happy surviving. You're really not. There's some antidepressants cause a loss of appetite, like ADD, ADHD medications, all those mess up with your appetite. Because they're trying to stimulate your go part of your nervous system, your sympathetic nervous system. That's what they're trying to do. Because you're too relaxed, they're trying to open the brain up, get it going. So, heart and lung, heart disease, COPD, emphysema, obviously it's, commonsensical, less oxygen, less breathing, more problems, less function. This was a cool theory. This came out, this was in 2000. I kept this in my, I got a big thing. My mom and I are trying to go through and put all this stuff, because once I find a piece, I try to put it in there, but it's been piling up. So, but Dr. Lerner said day-long cardiac monitoring found that 95% of chronic fatigue patients he and his research team tested in 2 separate small studies had abnormal electrocardiograms indicative of heart damage. Dr. Lerner said he suspected the heart damage is caused by Epstein-Barr virus, cytomegalovirus, both long implicated in this condition. Remember, these viruses like to go after muscles. That's why you feel tired. What are your strongest muscles in your body? Your leg muscles, right? Your back muscles. So when something's going to go after it, you're going to feel tired. You're going to release those chemicals going to make your legs tired. God, I want to go sit down. Then you got this posture, and then now you got this posture. It's all because you're fatigued. So I thought that was kind of cool that they mentioned that 80% chance also of having a herpes virus. Epstein-Barr virus is a herpes virus, like I said. Lifestyle factors, everybody knows, alcohol use, abuse. Caffeine use, caffeine can give you a little push, a cup of coffee in the morning, but if you start doing too much of it, it can really rebound, and then you won't get enough rest. I forgot all the statistics on caffeine. They had some neat caffeine articles on how it can affect your sleep-wake patterns, the different waves in the brain, which is kind of neat. Excessive physical activity, excessive anything, excessive drinking, excessive, anything will make you tired. Inactivity, everything's balanced. Lack of sleep and uneating healthy. Chemicals, I just want to point out, there's cases, organophosphates, silicone. I had a lady that came in, she had carbon monoxide. So I put her on a program for carbon monoxide. The doctor that she saw was really smart. He caught on to it right away. Ran the test on her. We found carbon monoxide, put her on a supplement program, and because carbon monoxide replaces oxygen on your red blood cells. So it kind of crowds it out, kicks off the oxygen, and then you got a problem. And then sick building syndrome, formaldehyde, volatile organic compounds. So a chemical can weaken the immune system so it was unable to cope adequately with a subsequent viral infection. These are some industries. You know, spraying by tractor, helicopter, spraying agricultural chemicals, working at a chicken farm, head lice treatments, house fumigations of flea control or bed bugs. That's a big one these days. Handling flowers. The flower one is huge. There's a main chemical that actually causes breast cancer that's on a lot of those flowers that women work with, whether they're at Lowe's, Home Depot. There's some nasty flower chemicals. Insect control in hot countries with DDT, we're not doing that. Sand flies, greenhouse fumigation, a research plant, a lorry driver delivering, that stands for organophosphates to the farmers. Government inspectors in sheep markets. Daily farmers, daily exposure to organophosphates for fly control and the milking parlor. I'm not a big milk person. So these are just some ideas on how we can get this stuff going. Silicone is a trigger for chronic fatigue syndrome. I found this on one of the blogs for chronic fatigue. So you just, nutritional deficiency, first one, iron, B12. Vitamin D is huge for deficiency too, especially in Michigan. We get, like 250 days of overcast, 365 days, and we do the math. We don't get much. So, and then protein's a big one, like I talked about. Thiamin's a huge one, lactic acidosis. Zinc, if you don't have zinc and thiamine, you can't make hydrochloric acid, you can't digest protein. So your body's living off of cheap carbs, you know. And then water's a huge one. I tell people to drink a water before breakfast, drink a water after breakfast, drink a water before lunch, drink a water after lunch, drink a water before dinner, drink a water after dinner.
What about dairy?
No. I usually do before and after. This way you're not going to eat as much either. But, you know, I usually recommend anywhere. I mean, I don't want to feel like a canoe where I'm going to float away, you know, drinking so much water. I hate water. I don't like water, but my body likes water. So what I try to do with water is I try to make it a food. The way you make it a food and the way you can process it better by the kidneys is to add a little grape juice, add a little pomegranate juice, just a little bit. I always water down the kids' juices, always. It's usually 50-50 or 75-25. Iron always needs to be checked. Anemia. I also put that water up there because if you're an ice chewer, you're an iron deficient person too. You got pica. So iron deficiency is huge. Dizziness. Hydrochloric acid deficiency with iron. Low blood pressure. Pallor. You look like you're dead. Slow oxidation and then weakness. Iron excess can cause all kinds of problems too, so that could be an issue with fatigue. That's too much. Oh, okay. Basically, what else they found is the body has a tough time regulating, the immune system. When they tested people with chronic fatigue, they found that there's these cells in the body that are in the liver. They're called null cells or natural killer cells. And they found that people that have chronic fatigue or that get fatigued often or get sick often, their natural killer cells were dysfunctional or they didn't raise high enough levels to fight the infection. And that's what kept the fatigue going. Because somehow the natural killer cells reset the immune system. So basically, decreased natural killer cell activity is associated with severity of chronic fatigue, immune dysfunction syndrome. So it could make it worse, or it could be the culprit too. This data suggests a correlation between low levels of natural killer cell activity and the severity of chronic fatigue syndrome, which, if it is confirmed by additional studies, might be useful for subgrouping patients and monitoring therapy. We don't have to group anybody. I mean, there's so much information on this. Here's another one. This is actually what I use in the office to raise natural killer cells. There's a chemical, it's called perforin, and the fungus guy, which is the Ganoderma lucidium, actually raises natural killer cells. So you can actually use, this is basically saying what I use in the office is totally accurate. That's basically what it says. Yeah, that's not what we did. Here's another thing with the natural killer cells. It says current chronic fatigue syndrome treatments are directed at reducing the symptom severity, but no cure exists. Finding of the studies gives support to this concept and cause of chronic fatigue and related to infection. These findings may lead to therapeutic approaches. Here's what I use to increase perforin, and perforin is actually the chemical that is released from natural killer cells to kill viruses and various things. It's kind of interesting. I was looking for things because everything's supposed to match. When you got a good match, it's just kind of puzzle. Everything matches. It kind of falls into place. These two things fell into place because this interleukin 10 that I talked about earlier, this is a cytokine that's released by toxins, bacteria, heavy metals, everything but viruses. But what happens is this suppresses that, and it raises this, which raises this side of the immune system. That's how you do that. And then IAG raises natural killer cells. It's already been known. Natural killer cells are really important. You know, that's probably the one test I'd want to know if I had cancer. I would say, you know what? If I was going to do a blood test out of everything that I know, what test would I run? Besides your test over there for cancer, we talked about earlier. But what one test would I run to find out if I'm going to survive this cancer and if my body's strong enough to move on? It would be your natural killer cell count. So whenever your natural killer cell count is too low, you got nothing left in the body. That's why it makes you fatigued. Another thing is, women or even men that go through chemotherapy and radiation can experience chronic fatigue syndrome up to 15 years after you've had those treatments. 15 years. And that doesn't surprise me because that's basically they poisoned you. And poison raises the side of the helper cells by raising this in a vicious cycle. Keep on going. We're almost done here. So these are basically the way, this is my list of thinking that I kind of go through recommended treatments. Somebody comes in with chronic fatigue, or or shingles, or whatever they have. I always want to increase the natural killer cell capacity. I want to lower this chemical. I want to raise this chemical so you activate the viral side of your immune system. I want to reduce inflammation. I want to block this, because this can create very fatigue and tiredness, oxidation, that's as simple as that, release inflammation. And then you can even integrate a high lysine, low arginine diet, and then you can go in and say, hey, was this, did this thing wipe out the thyroid because I got thyroid antibodies? Or did this thing make my adrenals tired? Or is my liver producing all those chemicals? So this is just a little cheat sheet, and I think in the back of my head which way to go with the immune system in certain conditions. This is the one I use to lower interleukin 1, or interleukin 6. Remember your brain makes your muscles tired. This is the one I recommend for people in the gym. Because this chemical in here, in that herb, blocked that. So if I was an athlete and I wanted to keep things legal, and you wanted to get a little extra push, and it doesn't show up on a drug test, there's nothing going on, this is what I'd use. It's a fair way to cheat. You're not cheating, you just got more knowledge than somebody else because you applied it correctly. And then rhodiola is a huge, huge anti-fatigue pill. I use it if it's just a general fatigue and like driving, where 20 or 30% of all accidents, that would be the pill that I would use if you're driving long distances, if you're a nurse and you work long hours, if you're a doctor and you work long hours. And then obviously blood chemistries. I read blood chemistries. People come in with blood chemistries and I just tell them, you know, what area they should be in, what they need from a nutritional standpoint, not from a drug standpoint. What type of natural compounds can change the blood chemistry to make your numbers go away or disappear? And that's just the facts of it. Does anybody have any questions? Yes.
Do you recommend any essential oils for fatigue?
It depends. I mean, that's a whole other topic, but I would recommend, I like evening primrose oil. I like black currency oil. I like evening primrose oil. Not the DHA and fish oil and krill and salmon and all this stuff, but I like evening primrose oil because it showed that it did very well with the immune system, especially with females that had autoimmune. And it helps with cramping. And a lot of females have uterine cramping because of their cycles, but if you have a viral, it'll also help with muscle cramping and it won't allow the muscles to get tired and fatigued. So I like eating primrose oil or black currency oil if you know you're in an immune dysfunction or you have antibodies or autoimmune disease. Does that make sense?
No.
Evening primrose or
No,
black
I would
currant?
agree. Essential oils like peppermint or lemon or
I like
fatigue.
you can use lemon balm, you know, you can use lavender. All those help change, you know, physiology. I'm talking about ingestible
lavender
oils.
makes you sleep.
Yeah, lavender's good. There's a lot of essential oils. I mean, you know, it's its own topic. But as far as from this lecture, what I've seen is evening primrose oil and black currency oil ingestible. Any other questions?
Flowers. If you use gloves, will that help?
Sure.
I mean,
Yeah, it always helps. Gloves, a mask, a half-back suit.
great.
You know, I said that because you can breathe this stuff in too. So,
Oh, that's true.
yes.
If you exercise excessively and you produce interleukin-10 and that reduces your serotonin, what about your endorphins?
Well, I didn't discuss endorphins. Endorphins are a big one. Endorphins are covered under rhodiola. So if there's an endorphin issue or somebody's always sensitive, like trigger points, you test for fibromyalgia in different muscle areas, then I would add the endorphin and the rhodiola would do a good job of that. So that's how I would handle that. Just depends on your scenario. I just want to give a couple examples on and there's so many different things out there that people can have, but endorphins are huge. That's why I like that. Endorphins, high endorphin levels raise natural killer cells. So there's different ways to raise natural killer cells. It just depends where you're at, how bad you are, and how far you've gotten away from reality. Okay, does that make sense? So endorphins are big. I didn't talk about them, but I did do a lecture on endorphins. It's on YouTube. Any other questions? Yes.
I was reading an article and it was talking about the three whites, the sugar, the three whites, sugar,
Yep.
flour, and salt. Now, would that be beneficial to try to take those out of your daily diet?
Well, that's how you know you're fatigued, is because a lot of those things are cheap carbs. And a lot of those foods that you crave are cheap ones because you don't have the digestive ability or your digestion is shut down, so you don't need to process those as much as fats and proteins. So that's another indicator that you have fatigue.
Oh,
Because you grab those things all the time and you're trying to artificially raise your energy level because it doesn't have to go into it goes like alcohol, right from your stomach into your blood. So you're getting cheap energy. Yes.
If you don't have a gallbladder, does that interfere with the production of your interleukin?
Yeah. Gallbladder, I usually recommend supporting the gallbladder because just because the gallbladder's not there, there's still a liver problem because that's how it started in the first place. So I usually use Beta Plus, which is anybody that's had their gallbladder removed, replaced, whatever. Well, they're not doing those yet. But I use Beta Plus because it supports liver biliary. Because you don't want to be running to the toilet when you have a piece of cheesecake or you eat something or it's too rich for you. So it kind of helps that out. Plus, when you get sick, it enhances that ability to get rid of a lot of these infections that you might have, at that time. So yeah, biliary support is very important. Yeah.
I have a question. I have a sister that had breast cancer and thyroid cancer. And to treat, she has chronic fatigue. She was somebody that worked out all the time. But now that she's on Synthroid, all these medications for the thyroid and the cancer, for the breast cancer, she has to be on a hormone
Replacement.
How would you treat somebody with a natural supplement? How would that work with the medication that she's on?
Well, I got a couple different ways I can treat them. I could do the Acera on them. I could do the muscle testing.
Okay.
I could just listen to them like you're talking to me and go in and maybe do something for the liver first.
Okay.
There's no cancer that's going to grow in the body and the liver be working correctly. That's why drugs work so good. They bypass the liver. They have to form 2 to 3 times where the drug passes through and the liver can't break it down. That's where you get the half-lives for a lot of these drugs.
I got a plug bio to show you a picture.
Oh, cool. So yeah, I would.
But I still have my gallbladder.
I would do some with the liver. She definitely needs to be on iodine. She definitely needs her vitamin D levels checked. She definitely needs her hormones checked.
Yeah.
I mean, there's a spew of things you can do.
Now, would that 7 keto, that new thing, the 7 keto zone, would that help or would that cause more problems?
No, it wouldn't cause more problems, but you just be wasting your money. You gotta have a priority.
You gotta have it.
Yeah, you gotta have a plan.
Okay.
Yeah. Any other questions? All right, if you have any questions or personal questions you want to ask me, just stick around. Other than that, we'll see you guys later.